My name is Dr. Douglas Srygley. I'm a gastroenterologist with Austin Gastroenterology, and I practice down at St. David's South. And today we're going to be talking about colon cancer and why you should get screened. So, a couple of questions with colon cancer screening. One, why is it important? How do you do it? Who needs it? And which test should I do? So we're going to start out first with why it's important. The first reason it's important is it's common. It's also potentially fatal. It's responsive to treatment at the early stages, it's slowly growing, and it's potentially even preventable. So let's go through each of those one by one, because this is really the heart of the talk. First, it's important because it is the third leading cause of cancer. You can see here on this graph that this on the left is the men and how often they have different kinds of cancers. You can see that for men, prostate cancer is number 1, and for women, breast cancer is number 1. But number 3 for both groups is colon cancer. So this is a common cancer. Many people will get it. Here's another way to look at it. This is put out by the CDC, and it gives you the incidence rate of colon cancer according to race. You can see that African Americans have the highest incidence of colon cancer, and Asian Americans have the lowest incidence. But the key is that they're both pretty similar. Somewhere between around 4 to 6% of people will develop colon cancer. That means that if you're in a room with 20 people, one of you will develop colon cancer. So it is a common cancer. The other thing that's important about colon cancer is it is potentially deadly. That makes it important. If it is common and it can kill you, then we want to do something to stop that. So here's a graph of the mortality of cancers in the United States. And mortality means what percentage of cancer deaths are caused by each cancer. You can see that the number 1 cancer, regardless of male or female, is lung cancer. But number 3 for both women and men, coming in at right at about 8%, is colon cancer. So it affects men and women both. It is common, and it can be deadly. Here's another slide that looks at our colon cancer survival rates. And the reason why this is so important is this tells us that if we catch the cancer early, patients do well, and if we don't catch it early, patients do not do nearly as well. So on the left, you will see a graph that's purple for men and sort of a light pink for women, and that's the patients who are found to have colon cancer at stage 1. And you will see that there is a great survival. You can surgically resect the cancer, and patients do very well. Upwards of 90% of patients are alive at 5 years. Now, if you'll go farther over to the right, you'll see the same graph for stage 4 cancer. And you will see that for those patients, the survival at 5 years is much lower, 80 to 90% lower. So it's very important. If we catch this cancer early, you are likely to do very well. If we catch it late, when it's already left the colon and gone to other places, then you are much more likely to have an outcome we don't want. We know how colon cancer develops as well. Colon cancer starts out as a polyp and over a long period of time then develops into a cancer. We call this the polyp to cancer pathway, and it in general takes about 10 years. So a patient will start off with a very small polyp, maybe 1 to 2 or even 3 millimeters, and then there's some changes to the DNA over time, and the polyp will get larger and also have some changes in it that we call dysplasia. Over the course of time, the polyp will get even larger, and then eventually the polyp will change where it will start to invade into the layers of the colon, and at that point it is cancer. One of the very attractive parts about colon cancer screening is if we can catch these polyps before they become cancer, then we can theoretically even prevent that cancer from ever even happening. So if we catch a polyp early, before it becomes cancer, we can take it out and do something about it, and you might never even have that cancer to deal with. So how long does it take for a polyp to develop into cancer? Most theories think that it takes us about 10 years to go from a polyp into cancer. Now, obviously, we do not have this data perfectly, as you can't really do that experiment on anyone. The other thing to know about colon cancer is even once you have a colon cancer, in general, for the majority of patients, it grows slowly. The best studies say it takes about 600 days for it to double in size. So that means that we do have some time with this cancer, but we do want to catch it. So how do we screen for colon cancer? There are a bunch of different ways to screen for colon cancer, and we have them all written down on this slide, but we're going to talk about the ones that are probably the most frequently used at this time in the United States. One of the most popular ways is by doing a test on the stool. The most common stool test is called a fecal occult blood test or a fecal immunohistochemistry test. We'll come back and talk about this one more later. Cologuard is another stool test. A couple of tests that are not done very often are called flexible sigmoidoscopy and barium enema, and we're going to skip over those today in the sake of time. There's also a virtual colonoscopy, a colon capsule, and then colonoscopy, and we'll talk about all the ones that are bolded. So what is a fecal immunohistochemistry or a fecal occult blood test? So this is a test that detects microscopic blood in the stool. It is designed to catch at least a small drop of blood. And the reason we do this is because colon cancers will oftentimes have just a slight amount of bleeding. And if we can pick up on that, then we know that there is a concern for cancer. How you do this test is you do it every year or every other year, and the test is super easy. All you do is you take a little bit of stool and you smear it on a card, and then there's a special test that's run to see if there's blood on it. It can be done from home. There's no anesthetic required. There's no preparation required. It is super easy. Now, if you have a positive test, then you do have to have a colonoscopy to see if in fact there is a polyp or cancer there. The one downside with this test is that false negatives, meaning there could be a cancer and the test is negative, can occur, as well as false positives, meaning the test shows that there's blood but there's no cancer. So does it really work? It actually does. So the bars in the dark blue are a study that was done with a fecal immunohistochemistry. And these patients, this had a one-time test where they looked for blood in the stool, and then they went back and saw if they had colon cancer. And you can see on the left that the patients with stage 1 disease, they found colon cancer 61% of the time in the patients with colon cancer. And with stage 2 disease, it was up to about 70, and stage 3 almost 90. Now you can look at this and say, well, that's not a very good test if you only catch it 60% of the time. But this was a one-time test, and these tests are meant to be done repeatedly over many years, which increases the chance that they're going to catch it and increases the chance that they're going to catch it in a timely fashion. So while not perfect, still very helpful and very easy, and certainly will not cause harm. So the advantages: it's easy, it's cheap. Oftentimes your employer will pay for it and it won't cost you anything, and it can't possibly hurt you. You don't have to be put to sleep. There's no risk to it. Disadvantages: well, it's not perfectly accurate. It does not help remove polyps, and quite frankly, it's not really even designed to catch polyps. So it just really catches that cancer. You don't get that benefit of cutting that polyp out before it becomes cancer. And many patients still require colonoscopy. A lot of patients, when we tell them about this, have kind of the ick factor of, oh, I don't want to put my stool on a card. But I'll tell you, the vast majority of the people get over that, and it's not a big deal. What else can we do? There's a similar test that just came out called a Cologuard, and it is kind of similar from the patient's perspective to the fecal occult blood test, in that you take a little bit of stool and you smear it on a card. But this one's a little fancier, and then it looks for some DNA. What happens is when tumor cells kind of proliferate, that they can shed some DNA that's unusual, and we look for that in the stool. So how well does that work? It works pretty well. We're going to go back to that same graph, but this time look at the light blue bars. And you can see that it picks up cancer pretty well, about 85% of the time for all comers. So it's an easy test, and it has pretty good accuracy. It can also even sometimes pick up polyps. So this is another graph from that exact same study. And if you'll look at those light blue bars, you'll see that about 60% of the time it'll pick up large polyps. So it can even maybe help you with some of these precancerous polyps. Now, if you have it, you're still going to require the colonoscopy. The advantages, again, are similar to the fecal occult blood test. It's easy, it's safe. Disadvantages: no polyp removal. There's only been a couple of studies with it, so it hasn't been around nearly as long as the fecal occult blood test. And you'll still require a colonoscopy if it's positive. The other thing is, with the fecal occult blood test, you get that every year or every 2 years. With the Cologuard, you only get it every 3 years. So we have some concern it might not have as good a long-term benefit as doing a test every year like the stool blood test. You should not use either of these stool-based blood tests if you have any of these conditions. If you've previously had polyps, if you have a family history of colon cancer, if you have a family history of, a personal history of inflammatory bowel disease, if you see blood in your stool from hemorrhoids, it's going to be positive. No sense in doing it. It doesn't help. The other thing you should know is for all patients, the older you get, the higher risk of a false positive. Another test is called virtual colonoscopy or CT colonography. And this is a really cool CT scan where a CT is done and essentially the radiologist can almost walk through the colon and look for polyps that then can be seen and removed with a colonoscopy scope. It does require a prep. So one of the downsides of this test is just like a colonoscopy, you have to drink the stuff and have the terrible diarrhea. You don't get out of that. The good side is there's no sedation, so there's a little bit less risk, and most patients tolerate it well. So does it work? One of the advantages of virtual colonoscopy is not only does it pick up colon cancer, but it picks up polyps. So you'll see from this graph that if there's a polyp greater than 5 millimeters, and 5 millimeters is about 1/4 of an inch, so if a polyp greater than 5 millimeters, it'll catch it about 60% of the time. But if it's a polyp up to a centimeter, which is about a little bit less than 1/2 an inch, it catches it about 85% of the time. So it's a good test. So it's got excellent test characteristics. You don't have to be sedated. You tolerate it well. The other thing that can be a good or a bad is sometimes when you get that CT scan, you can even see other things that are outside the colon that might be of benefit. There are some big cons. The biggest one is if you do the CT colonography and you find something, you still have to undergo a colonoscopy, and it's almost always on a different day, so you got to get 2 preps, and that goes over like a lead balloon. There's a low risk of adverse effects, and it can be a little bit uncomfortable when you have the test done. The gold standard is colonoscopy, and colonoscopy, I think most would agree, is the best test. What a colonoscopy is where you take a little camera and you snake it all the way through your colon, as you see on this picture, and you look for polyps or cancer. So what do we look for? The picture on the top left is a picture of normal, beautiful pink mucosa. Looks like a beautiful colon. On the bottom left, you can see a polyp. So that polyp is about 1.5 centimeters, and if left in place, would likely or possibly develop into cancer. On the right, you see what a colon cancer would look like. I want to point that out because that also explains why the fecal occult blood test would work. You can see that that cancer is intermittently causing a little bit of oozing bleeding, and that's why we do the fecal occult blood test, because it's going to ooze a little bit of blood and we're going to pick it up and then do a colonoscopy. So how do we remove a polyp if we have it? The best way is usually with what we call a snare. And so this is kind of a schematic of that. On the top left, you'll see the polyp, and then we wrap that snare around it and pull the snare tight. On the snare, we have a little bit of electrocautery, so it heats it up and kind of fries it, and then we burn right through, and then we can suck it through the scope channel so we can send it to our pathologist to make sure there's no cancer in it. Here's kind of a real-life view of what that looks like. On the top left, you'll see the polyp. It's kind of got a little stalk on it. The colonoscopist has injected it with some medication to make it really stand out. You can see it on the bottom left. And then on the bottom right, you see what it looks like after we've snipped it off and there's no more bad tissue there, and we've solved that polyp. Does it work? So I really like this graph. This is a relatively recent study that showed not only does it work, but it can prevent cancer. So this was done up in Massachusetts, and what they found is if we removed polyps, we decreased the chance of the patient developing cancer by 50%. So not only can we find cancers early, and if we find them early, patients do better, but we can even decrease the chance that you'll develop colon cancer, which is even better than catching it early. One thing that also we know why colonoscopy works is we know that the more polyps we find, the better patients do long term. This study was done looking at how well doctors were at finding polyps, and the doctors that found the most polyps, their patients then had the least chance of developing colon cancer or dying from colon cancer. So if we can find polyps really well, you'll do even better. So the advantage of a colonoscopy, it's the gold standard. It is not a perfect test to look for colon cancer. Studies show we miss maybe as many as 5 to 10% of polyps, but it's the best test. And you can remove polyps and maybe likely even prevent cancer. You don't have to have it that often. For most patients, you only have to have it every decade unless you've had prior polyps or a family history or some other cause of repeat colonoscopies. There are some disadvantages. The biggest one is the prep. Patients hate the prep. You do have to be on clear liquid diet the day before, and we'll give you something to clean you out. It's very important, but it's not particularly popular. It can be costly, and it can be invasive as well. One other thing that I didn't put on the advantages is that most patients actually like the procedure. You should know that during the procedure, you are put to sleep, so you will be comfortable. It's really just the day before that you won't like us very much. There is one new option for the prep as well. We are working to make the prep as least invasive as possible. We do have a new option here in Austin called Hygia Care, where you don't have to take any oral prep, but instead we're able to administer the prep rectally, and patients have really started to like this. So who needs to be evaluated? Anyone over the age of 50 needs to undergo evaluation for colon cancer. Some patients may need to be screened earlier, such as if you have a family history of colon cancer or polyps. If you have a personal history of colon cancer or polyps, or inflammatory bowel disease, or a hereditary cancer syndrome, you might need to be screened earlier than the average person, even in the absence of symptoms. Additionally, if you have symptoms that are concerning for colon cancer, you might have to undergo an evaluation earlier. We know that the fastest growing group of patients with colon cancer are those under the age of 50. So we need to take any of these symptoms seriously. If you have blood in your stool, if you have a change in bowel habits, new constipation, weight loss, iron deficiency anemia, black stool, any of these might necessitate a colonoscopy. So the take home. The most important thing I tell patients is the decision to do a screening test is more important than the screening test you choose. We always say that the best screening test is the one that the patient will do. So if you think I will not do a colonoscopy, but I'll do a stool test, do a stool test. I think colonoscopy is probably the best screening test, but again, the best one for that individual patient is the one that they will actually do. The patient and the provider, so your doctor and you together, should decide how you're going to screen. But the number one lesson today is go out and get screened.